Good evening, everyone. Thank you for joining us for this conversation around the COVID-19 vaccine in long-term care facilities in Contra Costa County. We appreciate you making this a priority and the time to join us. This is an interactive session brought to you by Contra Costa Health Services, Choice in Aging, and Ombudsman Services, and just designed to give you, family members, and support for those in long-term care, some information and peace of mind. Our webinar will be led tonight by Dr. Levin, one of our deputy health officers here in Contra Costa County. She's going to go over some spreadsheets and review some information for you. And then we'll be opening up to questions. So I want to encourage you to look in the chat because Debbie Toth from Choice in Aging will be dropping information in the chat as we're discussing things. And that's where I will look for questions. You can drop the questions in either the chat or the Q&A, and we will ask those at the end of the evening. I also want to highlight that Choice in Aging has provided translation thanks to in Tagalog and Spanish, and it has been dropped in the chat. If you'd like to use those conference lines, please see the chat now, and we look forward to having you with us. So with that, Dr. Levin, I'm going to turn it over to you. Thank you so much for being with us today.
Good evening, everyone. I'm happy to be here and very excited to be talking about the coming vaccine, which is going to help us all get our lives and our communities back to normal. And so what I'd like to start with, I really want to allow plenty of time for questions and answers. I know people have a lot of questions about the vaccine, but I'd like to start with going over a set of slides that really, I think, try to ground us in exactly how the vaccine was developed, why it's safe, why you should get it, and try and address probably some of the questions that I think you already have. So I am going to say, you know, there's still, in terms of the planning and the rollout, we are, you know, just getting today, we got our second doses of Pfizer vaccine and our first dose of the Mrna vaccine, which was just approved on Friday. And so we are working with all hands on deck at the county to make sure we roll out this vaccine and make it available in a equitable and ethical way to those who are most affected by infection with coronavirus. But it is going to, there's still a lot of planning going on, and we still don't really know how the supply chain will come. So I won't be able to answer a lot of questions about exactly the timing, but I will try and do my best and show you where the resources are going to be real time in order to find out this information as the days and weeks go by. So with that, let me share my screen, and I'm going to start going through the slides. Actually, you know what I will do, I'll start with where you can find information in real time as the days and weeks go by. I want to show you, we have developed a website specifically for congregate living facilities in Contra Costa County. And this is the landing page at cchealth.org. And on this, you can find a lot of resources for families and caregivers. There's also the Congregate Care Playbook that we've developed with the Institute for Healthcare Improvement, which really is, we had some family members on our group that was developing that, and we're hoping to use that as a real tool where facilities can put into action the real guidance around infection control and prevention, and preventing people before they get access to the vaccine from the infection with coronavirus. Includes things on visitation policies. So please feel free to check that out. And from there, you can also get to our, right here. From the main site, the cchealth.org, you can get to there's vaccine tab is where you will be able to find updated, right now we just have it in Spanish and English, but here they will be updating it regularly with frequently asked questions. So that's why it's in this format. It also shows you how many vaccines have been administered so far in our county. And really this will be the place to get your information on a day-to-day basis. So I just wanted to highlight that. Now let me go to, hang in there with me. I just want to pull up. Okay. All right. Whoops. All right. Sorry about that. Give me a second. So again, this is the website address where you can find that vaccine page in real time and up-to-date information. So why should I get vaccinated? The reason you should get vaccinated is to protect yourself and your family and your community, to keep residents safe in these congregate facilities where we know the risk if you contract coronavirus is of serious consequences, including death, is so much higher than in other places. So protecting the residents who live in these facilities, to stop the spread in our community at large, and to set the example for others in your networks. The more that people accept and start getting the vaccine, the more confident others will feel that it's safe to get and that it has protected them. So the first two coronaviruses vaccines that have been developed and released are the Pfizer vaccine and the Mrna vaccine. They're both using the technology of mRNA, which I will explain. This is not a vaccine that contains a live or dead virus. What it contains is the coding sequence for one of the proteins that is on the coat of the virus. So what it's designed to do is to introduce your immune system to what the virus looks like. So it can see it, what coat it wears, essentially, recognize it if you get exposed to it, and be prepared with an army of immune cells to kill it and rid your body of it so that you don't experience infection. The only way that this is going to work, that vaccines are going to work, is to get enough people that are immunized, that have immunity, that the virus basically has nowhere else to go in society, no one else to infect, and it dies out. So this is the way we're going to get our world back to normal and control the COVID-19 pandemic. So a little bit more about how the mRNA COVID-19 vaccines work and what the technology is behind them. It's not a new technology. It's been around for at least 10 years, mostly being used in things like cancer treatments. So it was developed as a way to have your own body's immune system be able to respond to cancer cells and target them specifically. So it was a big breakthrough technology in cancer treatments and being able to recognize what the specific type of cells that need to get rid of, rather than killing the good cells with the bad cells. And this I'm talking about an example of cancer. So this is one of the first times that there's been a vaccine developed using this technology. But what it does is it uses this harmless of coding material, the mRNA, which then basically directs your cells to make this protein so that then the immune cells get enough exposure to the protein that they can recognize what the virus looks like and is able to catch it at the first introduction. And the basic technology, I think of it as like sending your immune system to boot camp against COVID-19. So it's basically learning how to exercise that muscle to recognize the virus and kill it. It can't give you COVID-19 and it can't change your DNA. The way that the mRNA works is it uses the production machinery of the cell to make the protein, but it does not go into the nucleus or have any interaction with the DNA. Will you still need to wear a mask? Yes, we will still all need to wear masks and continue with our measures until we are at a place where we really have had enough people vaccinated in our society and enough immunity that the virus is not able to spread. Similar to other vaccines, they're estimating about percent of people have to attain immunity in order to be able to get to a place where we start to see herd immunity, is what they call it, meaning that there is really no route for the virus to keep surviving and spreading because so many people are immune to it. So the other part of this, of course, is that although these vaccines have proven to be incredibly effective at 95%, nothing's 100%. So you will still have people who aren't able to mount a sufficient immune response to the virus. What if you've already had COVID-19? So the recommendation is that you should still get the vaccine, and largely because we don't know how long that immunity sustains for. And so if you're starting to have waning immunity, which we think probably starts in those after a few months having been infected, or potentially if you didn't get a very large immune response to the initial infection, this would be a way to ensure that you're protected and boost your immunity. So it is that you get vaccinated, even if you have had it and even if you have positive antibodies. Really important that you get your information from accurate sources. There is so much misinformation out there on social media, and then people furthering opinions based on that misinformation. So it's really important to go to reliable sources. I showed you at the beginning our county vaccine tab website, which really will be sourcing from both these CDC sites, but also our trusted state public health leaders and the best and most reliable scientists and thinkers in this work. Okay, so a little bit more about sort of how the vaccines work and how long it will take for you to be protected. So far, although there are over 13 vaccines in development right now, there are 2 that we have that have been approved, and they are both 2 doses. The Pfizer vaccine is 3 weeks apart, and the Mrna vaccine is 4 weeks apart. So we do know that that first shot does start to build immunity, but you are not up to that 95% effective immunity until you're 1-2 weeks after the second dose. So it's really important that you get that second dose. We won't know how long the vaccine is effective until we have more time to follow. But what we do know is that the people participated, which was close to 70,000 people in these Pfizer and Mrna vaccines, are continuing to be followed. So we will have more information as time passes. The speculation is that this may be like a flu vaccine where there will need to be development and new vaccines on an annual basis, potentially, to keep up with any type of changes in the virus and the viral proteins. So it may be that COVID-19, this novel coronavirus, evolves into a type of infection that we need to do boosting immunity with further vaccine development going forward. Are the COVID vaccines safe? This is what on everybody's mind, understandably so. Safety is the most important part of the vaccine development process. It is the priority of all vaccine development. Most side effects occur in the first 6 weeks. Truthfully, the great majority of side effects occur within the first 48 hours of receiving the vaccine. But the safety window, they say, is 6 weeks for serious, unpredicted side effects. The FDA was more cautious and requires 8 weeks of safety monitoring for the COVID-19 vaccines. And monitoring is continuing as the vaccine is distributed to the public. There are very strict mechanisms for reporting any type of adverse effects to the vaccine, both on the part of the distributors, the people giving the vaccines, and a place for the public to report. So monitoring for safety will continue. To assess safety, there's, in the initial approval process for the vaccine, the FDA requires a minimum of 3,000 patients. There were close to 30,000 patients in the Mrna vaccine trial, and there were close to 50,000 in the Pfizer trial vaccine. So they had 10 to 20 people as what's required to get approval. Should we trust the COVID-19 vaccine? You should be reassured that there's the same strict standards that have been true for decades. No steps were skipped in the process of the FDA, in the process of developing these vaccines. There were 2 independent advisory committees, actually 3 in the Kenya, that reviewed the results prior to the approval. These were experts of these committees that have no conflict of interest, are not associated with the vaccine manufacturers, have nothing in the vaccine development. This is the Vaccine and Related Biological Products Advisory Committee that advises the FDA, as well as the Advisory Committee on Immunization Practices, which advises the CDC. In addition, California required that the Western States Scientific Review Board do a 3rd independent review of the Pfizer vaccine before California accepted it. How were these vaccines developed so quickly? Well, the major reasons that we got these vaccines developed more quickly is because we're in a pandemic, and all the global effort with the world's leading scientists were focused on the single task of developing this vaccine. There was nearly unlimited resources, money, knowledge, people power, and technology going into these developments. We're likely to see many more going through approval processes, as there are, as I said, up to 13 in development across the world. There was a large pool of diverse adult volunteer trial participants. People really came out and supported the effort. I've been saying this is probably the biggest thing our health department has ever done in terms of a deployment effort. And so it's really been, and I think we're just a microcosm of the larger world. And what is an emergency use authorization for a vaccine it's based on the need to use a vaccine quickly because we're in a public health emergency. It's a shorter process because some of the bureaucratic steps are taken out, but no steps are skipped in terms of the safety evaluation process. It just brings people to the table with much more urgency. The FDA will assess if the vaccine known and potential benefits outweigh the known and potential risks, as they've done. And then, as I said, the two advisory boards reviewed the data, are completely independent of the vaccine developers. So the EUA does not imply that the authorization was done too quickly or that the vaccine is not safe. Just to give you a sense of who was included in the vaccine trials and the diversity of the group, there were, as I said, over 40,000 and over 25,000 in each of those respective trials. There was racial and ethnic diversity of the participants, and many of them, especially in the Pfizer vaccine trial, 45% were 58 or older, 56 to 85 years. About a quarter were over 65 years in the Mrna vaccine development. And what they showed was that across different race, ethnicity, and age groups, that there was 95% protection from having, so meaning that if you got the placebo group, they saw versus those who got the vaccine, in the vaccine group were 95% less likely to get the infection. So the vaccine can't do COVID-19, but it can make you feel the effects of your immune response to COVID-19, because that's what it's doing, is training your immune system to start recognizing the virus. So people may have some short-term discomfort, such as fatigue, headache, muscle pain, chills, fever, pain at the injection site after vaccination. And that's a sign that your immune system is responding. The reactions in the great majority were resolved actually within 24 hours, but they say 24 to 48 hours. And typically they're more pronounced after the second dose. And that's also to be expected, because if you think about it, your immune system has learned from the first dose, and now it's going to give you a little bit stronger response with the second dose, because it's already prepped some of its soldiers and immune cells to recognize it and fight it. And then finally, it was important that you do get the second dose, because you will not be fully protected if you only get one dose. We know you will get some protection, but it is not the same as getting the second dose in terms of the effectiveness. And it's important to get the same vaccine as the first dose. So that is, I'm going to stop share now and go to our question and answer period.
Thank you, Dr. Levin. We appreciate that webinar. And just a reminder to participants, we'll be sending out the recording of today's session along with the webinar tomorrow afternoon. So you don't have to memorize everything that Dr. Levin said. I also was wondering, Dr. Levin, if we can start by talking about the pharmacy partnership and how community care licensing has treated the residential care facility for the elderly in this time. So could you maybe take a minute and talk about that partnership?
Sure. So the vaccine distribution is happening as part of a federally organized partnership with Walgreens and CVS for our skilled nursing facilities and our long-term care facilities. All of our skilled nursing facilities in our county did sign up for the federal partnership. our Department of Social Services auto-enrolled all of their licensees who are part of the residential care facilities for the elderly, and the adult residential facilities. So those have all the contacts and names and licensees have been enrolled, and it's an opt-out situation. So facilities should expect to hear from the pharmacy program. That being said, the federal pharmacy program is also prioritizing, it seems, it has a prioritization list. So we are hearing from facilities that they're being told that they are not, even though they were auto-enrolled, are not being included at this time as part of their rollout, and that the pharmacies are scheduling limited clinics with the facilities for distribution and administration of the vaccines. We at the county weren't quite sure how this was rolling out because we don't control that. That is happening through a separate distribution line. At the county, we're receiving our own allocations that are coming through the state, and working to prioritize how those vaccines get distributed, following along with the same guidelines that are a priority that are happening at the state level. In addition, we have a county group that's formed, an advisory group for the ethical and equitable allocation of vaccines, who are meeting, and Nicole Howell is graciously part of that group, but it's really trying to have representation, wide representation from all throughout the different sectors of our community, and groups to ensure that we are distributing equitably and ethically. And they have made recommendations and prioritization. That is all to say that part of what we recognize is that our top priority right now with our earliest vaccines are our acute care health workers, both paid and unpaid, and health workers, including all the people who surround those acute care hospitals and detention centers and psychiatric hospitals, and the long-term care facilities for the elderly, both the residents and the staff, and very much the staff, because we know that getting them vaccinated is going to keep our residents of those facilities from getting infected. This is, the language does include paid and unpaid workers within these facilities. So there's obviously going to be some need to prioritize, depending on, there's going to be a supply chain, determinants in terms of how much we can get it out. But and there's going to be some tiering that goes on in terms of who's most at risk for exposure. But our plan as a county is really to try and understand where the gaps are that's not being addressed by the federal pharmacy partnership program, and try and fill those gaps as much as we can within those priority groups.
Thank you. Dr. Levin, I'm seeing some general questions pop up here. So I want to just take a moment and do some education. So when we're using the term residential care facility for the elderly, or RCFE, that encompasses if your family member is at a really fancy big facility, or if they're at a fancy small facility, what we call 6 beds or boarding cares. And so remember that when we're saying that the community care licensing auto-enrolled RCFEs, that means every facility, a residential care facility in the county, has been auto-enrolled. So you can be sure that if your family member is in a licensed care facility, they are on the list. And I just want to make sure everyone's had a chance to hear that and let that sink in, that the vaccines will come from the facility, and it will be done irrespective of size. We've got questions saying, we're a small facility, will they still come out? The pharmacy partnership is going to contact all of the facilities, and they have said they're going to do on-site clinics. So I just want to assure you, it's not like a normal vaccine. They really recognize how important it is that everyone get that, and you will receive that. So, and that's if you're at a big facility or a tiny facility, that is being handled. Is that right, Dr. Levin?
Yes, that's correct. And as we learn more about where they are going and where they maybe have missed or where people have missed. We're also developing a huge, there's a huge whole branch at our operations center and team, and plans for developing mobile teams that will be going out to deliver the vaccine as well.
Great. So thank you so much. So the question is, can you talk about some of the side effects, both some of maybe the mild and possibly more serious?
Yeah, so what we know for now from the trials is that of those close to 70,000 people, there was really only a handful. I only actually heard of one report of a significant anaphylaxis reaction. When I say anaphylaxis, that means what we consider to be a life-threatening sort of allergic reaction, and that person did fine and recovered. They are recommending that there be a 50, that type of reaction occurs very immediately after vaccine administration. So they are recommending a 15-minute period of observation after receiving the vaccine, as well as some people are recommending pre-medicating with Tylenol or something like ibuprofen, a non-steroidal anti-inflammatory, if you are able to take either of those medications as a way to reduce potentially any side effects that you may get from the vaccine. But there really, you know, as I said, there was 70,000, close to 70,000 people in this trial, and really, and followed for 8 weeks, and have not seen some of those other types of severe long-term side effects, such as Guillain-Barré. People may have heard about that as sometimes a potential reaction that's significant, but none of that has been observed in these, and that's part of what they're evaluating in these safety trials.
Excellent. Thank you. So can you speak to that of, you know, if someone has a prior allergy to gluten or eggs or egg whites or nuts, like would this trigger a similar reaction to some other vaccines, or is that something they should be concerned about?
Yes. So this vaccine really, you know, I was sort of looking into this question because it kept saying, well, if you're allergic to anything in the ingredients in the vaccine, you shouldn't take it. That was really the only contraindication. And so I tried to find out what exactly are the ingredients. And really it's the only thing, sucrose, which is sugar, a type of sugar, and then the RNA material, the protein material, and then the vaccine is put into saline, so salt water, 0.9% salt water. That's how it's mixed. And so there wasn't, I didn't see anything in the listing of the vaccines that are, you know, such as eggs or these other things where they use in vaccine development that are commonly recognized allergens.
Mhm. Thank you. So can you speak to timing of the vaccine rollout? You know, we talked about the skilled nursing, acute care hospitals and skilled nursing facilities. When can families and residents expect to start hearing or that they have a clinic scheduled for the vaccine?
Yeah, and again, you know, this is an area where we are still learning because we don't know what supplies we're going to be getting, but anticipating that we're really talking about sort of starting in January, the first week of January is what we're. I mean, clearly we've already started administering vaccines in acute care hospitals, but the anticipated start date as I understand from the pharmacy, is the 28th of December. And then subsequent to that. But if you imagine with almost over 600 facilities, when we include all those smaller boarding cares in our community, that's gonna really roll out over sort of a period of weeks to months.
Okay. So let's say my family member's in a facility. I'm starting to get nervous that the vaccine hasn't happened in their facility yet. Do I have any other options? Can I call Kaiser, John Muir, or Contra Costa Regional and say, hey, my mom's in a facility, they haven't been scheduled yet. Can I bring her in for an appointment?
So really advise, again, going back to that frequently asked questions page, the vaccine page on our website. We will be updating that with any new ways to roll out. We will be messaging when we're ready to go. Certainly, I'm already getting, all of us are getting requests from different facilities. So we're forwarding those to our vaccine branch, and they are doing as much coordination as they can in real time to get this out as fast as possible. You can always contact through the COCO helpline, either by email or call the COCO helpline multilingual line. And we have our interpreter services working with that line. So regardless of your language, please call there. They will certainly route it to the appropriate person that may be able to answer it. Just, but with the caveat that sometimes the answer may be that we don't know yet. We'll have more information as we know what our supply chain is coming.
And I just want to say Debbie Toth has dropped these links and information in the chat box. Thank you, Debbie. We appreciate your partnership. And I think, what's great about facilities is we build a community with other residents and staff and family members. But sometimes group dynamics can be hard, where maybe other family members are saying, I don't want my mom or dad or uncle to have the vaccine, but another family member does. So can you just maybe speak to that again about how the vaccines will be administered and how it's independent from what other people want, that, everyone will get to choose for themselves?
Yeah. I mean, so, there's not going to be any mandate of getting vaccines. So people really are going to have to consent to themselves, or their decision maker is going to have to consent to receiving the vaccine. And that's part of why we think it's so important to get ahead of, even when it's available, to start answering people's concerns and questions, hoping that people will choose to protect themselves and their families, and that we can try and counter some of the misinformation that is largely spreading. So people should know that it's going to be their own choice to get the vaccine, or the choice of their decision maker. We do believe it's safe and protective. My colleagues who work in the hospital who've already gotten their first dose, I've heard from several of them, are already, if you're saying that, just it was actually easier than the flu shot in terms of their arm was a little sore at the injection site. But I think the only way it's going to work is as many of us get it as possible. That we know that it probably at 70% of people getting it is when we get to that herd immunity again. And what is if you part of the reason we're saying that people still need to wear masks after they get the vaccine is, what we know is that when you get the vaccine, you may be protected from getting, even if you're exposed to the infection, but there may be a chance that you're exposed to the infection. There's a little bit of replication of the virus before your immune system attacks it, and you could still spread it to others. That's one thing that we don't know yet enough about. So you may end up protected, but there's a theoretical idea that the other person who didn't get vaccinated may not be protected.
Yeah. We've got some questions popping up in the chat and the Q&A around sort of the federal courts and can employers require employees to be vaccinated. I just want to offer myself as an employer, many of my team members who are on this webinar tonight, that the way that we don't want to handle this is by saying you have to get vaccinated, because we already have a staffing shortage and we don't want to force someone to make a decision that they don't feel comfortable with. The way that we're addressing that in our community is by these webinars. Dr. Levin led this exact webinar earlier today for facilities, and we'll be doing it again in multiple languages. We're taking the approach that educating people around what the vaccine is and what the vaccine is not is a better way to handle that than mandating these things. And so I just wanted to offer that to all of you as we navigate this time of when can we visit and how does that correlate with vaccine. things will constantly change, but I think the way to work with that is to support facilities, not to mandate things. And so I say that as the ombudsman, that it's important that we provide resources and education to them. To that end, I want to ask you about sort of informed consent, particularly is what if the resident in a facility doesn't have the ability to make their own decisions? They experience dementia, but they do have a family member who's their responsible party. Is the facility required to receive consent prior to the administration of the vaccine?
Yes, they are. So they will need to have their whoever acts as their decision maker agree to it prior to administration. It does not require necessarily. So the pharmacy program right now did roll out with a written consent form. I'm not sure if they're gonna continue with that, because we feel that it puts another barrier in. That was not a requirement of the manufacturer and not a requirement of our any of our rollout, state boards or the immunization distribution, not our typical workflow for vaccines. And we are planning in terms of the larger community vaccination to use our testing sites that we've developed all over the county as also points of distribution. So it's likely that when it rolls out to the general public, you'll be able to roll in to get your test and your vaccine and be able to consent to it at that time. I also want to emphasize these vaccines are going to be free. No one's going to they may be able to charge for the procedure of administering. So at your health insurance, if you're covered by all, you're covered, that it'll be covered under that. But they were developed and paid for, the distribute and manufacture with U.S. taxpayer dollars. So your money has already gone into them, and you will not be charged for the vaccine. And we will be at our sites of distribution. You will be able to get the vaccine regardless of your citizenship status, regardless of your insurance status. So we're very aware that is something that the way we're going to be successful with this is making it as easy as possible, remove as many barriers as possible for people to be able to receive the vaccination.
Mm-hmm. Excellent. So are there any medications that have demonstrated to indicate that they have additional side effects, or is there any particular condition that a family member should be concerned about?
With regard to receiving the vaccine?
Yeah, sorry.
Oh, right. So you mean like if they have other conditions, will it worsen? Yes. So, what we're more worried about is those other conditions and getting the COVID virus. That is likely to lead to impacts in terms of how significantly serious the COVID infection is in you. There's no reason. All the people in these studies, as I said, many of them were older, had multiple comorbidities. There was nothing observed in reviewing those sort of subsets of data that suggests that there's any other co-illness that would prevent you from getting the vaccine. The only groups that we didn't test it in were under the age of 16. So these vaccines are not authorized at present time for use in people under the age of 16, and nor are they authorized for pregnant women, because they were not included in these trials. We're hoping that with the further trials that are going on, studying these vaccines and enrolling people, that we will be able to have those groups included in vaccine availability.
Okay. And if there were an adverse effect, would that be reported to Contra Costa health officers? No,
so it wouldn't come to us directly as the health officers, but there's basically a web. So if you're just like an individual, depending on where you got the vaccine, you would report it to the provider of that vaccine. You could also report directly to there's sort of a national web site that's set up where you can report your any adverse effects of the vaccine. And and we are required as the provider, so whoever's the provider of the vaccine, you'll get a sheet after the vaccine that will tell you where the location is to report any adverse effects.
Okay. So I just want to summarize a couple things you've said, Dr. Levin, which is first of all, that the vaccine partnership for skilled nursing facilities has been activated, and they'll likely begin to receive vaccines probably beginning on the 28th or so in skilled nursing facilities. But that the residential care facilities and the adult residential facilities has not been activated yet, but we are anticipating that happening in January. And lastly, that Contra Costa County is also deploying resources to ensure that every facility is reached. We had a question around, gosh, 600 facilities. We have more than 10,000 residents in long-term care in our community. So first of all, that it's free. Second of all, that the going to begin to roll out on the 28th. I think those are important things that to be aware of. So how do hospice residents fit in with this? Should they still receive the vaccine? Is there anything that the family should be aware of as they're making this decision?
Sure, great question. Yeah, so we are not limiting the recommendation to not include hospice. So we are recommending that hospice patients, if they choose to receive it, that they receive it. And largely because we think it will reduce suffering. If they acquire COVID-19 infection, it's a horrible way to die. People feel like they're unable to breathe, feel like they're drowning. So we think that that the hospice patients should receive the vaccine to prevent that suffering at the end of their life, and would not limit it.
Excellent. So at the vaccine clinics, who will be the person administering the vaccine? Is it a nurse? Is it a physician? Is it a pharmacist? Who is doing that work?
Yeah, so with the federal pharmacy partnership, it is pharmacists that are doing it. We are largely in the county will be nursing staff, but we're also looking at the possibility of having other types of licensed professionals provide it. So EMTs and paramedics, so the firefighters and the paramedics potentially, this is all in the works. So we don't know that it's happening yet, but we know we need to expand the type of staff that can provide it so that we are able to do this type of massive distribution. Really exploring what the possibilities are for expanding the workforce that could provide it in a safe way. So that would likely look something like you may have, a medical assistants or certified nursing assistants doing the injections, but overseen by an RN or a nurse. We thought about, the paramedics have already and EMTs are already working on expanding their scope of practice under the waiver in order to help provide more care in place should we need to supplement staffing in facilities. So although that hasn't rolled out yet, that sort of is on the table. So it's a real I think we're one of the, in every crisis there's opportunities, right? This is one of the times where we really start to look at our healthcare delivery system and say, how can we really reach and expand the scope of work of that people are perfectly qualified to do and can really help out and support their community. So it's exciting. I've never seen such a mobilization this whole pandemic has been such a mobilization, but with the vaccine coming, it's everybody's got a little bit lighter step, I think, just because even though it's a long dark tunnel that we're still in, getting through this surge, there is light at the end. And so I think we all have some hope that we didn't have a few weeks ago.
So when someone gets the vaccine, what will they receive? What kind of documentation will they be given? And will it say which version that they received? Like Nicole, Pfizer, Dr. Levin, Moderna, like, is it going to indicate that on whatever documentation they receive?
Yeah, definitely. So, because they will need to, and they're likely, the plan will be you get the first vaccine and then you're scheduled, you also get your window, your appointment for the second vaccine at that same time. And you'll probably receive a card that tells you which one you received and the date, where it was placed. It'll also go into our immunization registry system. So the California immunization registry, which is what the state uses to track, like childhood vaccines and all our vaccines. So, and you'll get an aftercare sheet that will give you the information about, again, where to report adverse effects, what to expect, how to take care of yourself if you do get some of those side effects that we talked about.
Yeah. Can you briefly, let's transition off vaccine just for a second and talk about COVID-19 testing and what the county has done to mandate testing for RCFE staff in Contra Costa County. Can you just speak to that for a moment?
Sure. So for the residential care facility staff, the mandate in conjunction aligned with the state mandate is that staff, when there's no outbreak, meaning no one has tested positive in a facility, staff or residents after baseline testing, that staff continue to be tested at the rate of at least once a month, about 25% of staff testing every week to sort of do surveillance screening of potential introduction of infection. Once there is a positive test, then it switches to what we call response-driven testing, meaning that everybody, both residents and staff, should be tested every week until there's 2 cycles of testing with no new positives. So that's the basic outline in terms of what's mandated stuff. We know it's been really challenging for facilities, especially some of our smaller facilities, to be able to comply with that. And that has been one of the huge motivations in both the development, of a widespread, easily accessible testing sites that you can access in the community, and our mobile testing team, which largely, although they started with going out to the larger facilities when we first started these mandates, now largely their work is focused on some of these smaller facilities because we know they don't really have the infrastructure to be able to do the testing.
Mm-hmm. So you've said so far, vaccine is going to be available to anyone in long-term care, either through the partnership or through the county, that it's free, and that anyone is eligible, staff and residents. So, people like to be scammy. So how is it that I would know if maybe someone's trying to scam me or the facility as it relates to the vaccine? What would be those triggers?
Yeah, so anyone offering to sell you vaccine, it's a scam. Anyone who calls and asks for any personal information like your social security number or your in order to give you the vaccine, it's a scam. And unless it's for insurance, that they're trying to that's an identifier for, so it's through a valid provider, through your provider, or through again this partnership. Anyone that is trying to again sort of give you a vaccine alternative, which I think there are scams going on right now, is a scam. So those are the major things. But you're right. I think that there is going to be attempts to do this and target, I'm afraid, elderly people, as many of these scams have done.
Yeah. So there's kind of this thread emerging, and I hear the concern and the fear, which is, okay, how do I know which vaccine my mom is going to get? Is it going to be through the pharmacy? Is it going to be through the county? And can I request which one I want my family member to get. So can you maybe speak again, just briefly, to how the vaccines are going to be distributed and ensuring that everyone in long-term care, staff and residents, receives their vaccine, both the first and the second dose?
Yeah, it's going to be a supply chain issue. So we, you, um, the choice in which vaccine you get may mean that you choose to delay because you want to get it through a different avenue in order to get that specificity.
Mhm.
But we do anticipate that, for instance, the pharmacy program sets up the clinic at a facility to vaccinate all their workers. Well, all the staff and residents. Well, that day, staff aren't going to, there's going to be staff that don't show up or don't come in. There's going to be residents who haven't made the decision to accept it yet. There's going to be, so those are the type of gaps that then, we'll want to hear about, and then try and support other scheduling efforts. Whether you'll get to choose the vaccine is really not, is going to be not determined. We may not have the choice to give you to choose, because we will have a supply that's limited. So that's the most I can say right now. I mean, I hope, you could choose at this point not to get it, and then you'll have it, it'll be offered through your provider net. If you have Kaiser or John Muir and you decide that you want to get it in your provider's office as opposed to getting it as part of this rollout plan. So I think those are where you'll have opportunity to make choices. We know that people are going to have different, personal timelines on which they decide that they're ready to accept the vaccine. And the recommendation really is to do some staggering, especially of staff in these facilities and in our acute care hospitals, of the vaccine, so that you don't have everybody going out the day after, or with the side effects at the same time. Those are all logistical realities of this rollout, so that we'll have to contend with, and hopefully together as a community, and do our best to ensure that people feel confident and safe in accepting the vaccine that they're offered.
Thank you. I'm also hearing a little bit of like dance with the girl who brung you. So if you get offered a vaccine and you want the vaccine, do not hold out to think well, if I hold out a little bit, I'll get the Mrna later on and that'll be easier. If you have an opportunity, and you feel comfortable taking the vaccine, I want to encourage you to do so. And from everything you have learned today, want you to encourage the facilities that you work with to answer the phone when the pharmacy partnership calls, to indicate that if your family member, if you're the responsible party, that you're giving consent for the vaccine, to proactively address this issue. Appreciate that. Lastly, Dr. Levin, let's assume that in a month from now, everyone's vaccinated. Can people go visit again?
Oh yeah, definitely. I mean, that's why we're doing it, right? I mean, this is once we get the general public vaccinated, once I think most of us are thinking, we're looking at sort of, by the beginning of summer next year is what we're really hoping for, is that's that we'll be able to celebrate on May Day and Memorial Day. But that being said, up until that point, we are still going to need to do all the precautions, right? The visitation can happen. It's just going to be still with the precautions that we're currently doing to keep each other safe.
Excellent. So I want to thank you, Dr. Levin, for all of the work you've done and for taking the time this evening to present. And I want to say to all of our families, this will not be the last town hall that we do. So as the situation evolves and as we have more information, Dr. Levin has graciously agreed to come back and to do this again with expanded information. So I just want to let you know that we know this is an uncertain time. We feel your concern and fear, and we are here for you. And we want to direct you to all of the resources that Debbie left in the chat and the phone numbers. We want to encourage you to reach out to our respective agencies if you have questions. And we ask that you come back again when we have more information. But we want to thank you for all of your concern and advocacy on behalf of your friends and family members. We hope you have a happy and healthy holiday, and we will likely see you in the new year. So thank you so much to everyone. Thank you, Dr. Levin. Thank you, Choice in Aging. We appreciate your time.
Thank you, everybody. Happy holidays.